Good afternoon. I'm John Begala, Executive Director of the Center for Community Solutions. I'm pleased to welcome you all to the City Club of Cleveland for this important debate on Ohio State Issue 3, the Ohio Healthcare Freedom Amendment. The City Club is the oldest continuous forum in the country. We have already started celebrating our 100th anniversary and invite you to join us as we celebrate throughout the year with a variety of events. Visit our website at www.cityclub.org//100. We have a long and distinguished history of presenting political debates which provide an opportunity for the audience here and throughout Ohio to be able to compare and contrast their points of view on candidates for office as well as for issues that are on the ballot. Each and every week throughout the year, the City Club presents interesting programs with informed speakers addressing significant issues of the day. We would be pleased to welcome you as a supporter of the City Club and our ongoing mission of civic dialogue. Both individual and corporate membership plans are available, and there is information about each on your tables. Our broadcast partner is IdeaStream, not only for today's program, but each week IdeaStream broadcasts the City Club forums live on 90.3 WCPN and Sunday mornings at 10 on WVIZ-TV. Television broadcasts of the City Club programs receive substantial support from Cleveland State University and PNC Bank. For further information about the City Club, including upcoming programs, or to make reservations or to order a CD or DVD of today's programs, please visit our website, www.cityclub.org. The rules for the opening portion of this debate are that each of the representatives of the for and against positions on Issue 3 will have a total of 3 minutes for an opening statement. After those opening exchanges, I'll be asking each campaign a set of questions. And following listening to that for a little while, we will encourage the audience to ask your questions and join in the discussion. Our two speakers today are Chris Littleton, who is a former president of the Cincinnati Tea Party and co-founder of the Ohio Liberty Council, an association of over 80 liberty-minded grassroots organizations across the state. The organization was formed to unite, inform, and empower Ohio freedom-loving groups and citizens to affect policy in favor of liberty. He is also a member of the ballot committee, which initiated the Ohio Healthcare Freedom Amendment, Issue 3. Chris lives in Westchester, Ohio, near Cincinnati, is a graduate of Ohio University. He and his wife, Kim, have been blessed with 3 children, Jacob, Katie, and Gavin. Chris also had the longest drive coming up here today. Dale Butland serves as Communications Director for Innovation Ohio and is the founder and president of Butland Associates. Dale is a frequent op-ed contributor to several Ohio newspapers. He has previously worked for Ohio News Network and is Democratic co-host for On the Square down in Columbus. Dale also served in the office of Senator John Glenn in several capacities, including Ohio Chief of Staff. We're very pleased to welcome our audience with us here today. I know many of you support one or other of the positions on Issue 3. We appreciate your giving everyone a chance to be heard. The order of the presentation today was selected in a drawing immediately before our coming out here, and Mr. Littleton will present first. Come on up, Chris. Sure, thank you. You can clap. It's okay.
Well, thank you very much for having me. Just a couple minutes to explain, I guess, where this came from. And Issue 3 is an amendment to Ohio's Constitution. We call it the Ohio Healthcare Freedom Amendment. Very basic things on it. A couple things that it does. At the state level, it's going to prohibit the state of Ohio from limiting your health care freedom. It does not force you to participate in a health care system. It prohibits purchase or sale of health care or health care insurance. Excuse me. And you also not be fined for purchasing this or selling health care or health care insurance. Initially, this was started in response to the federal mandate that came down from Washington, D.C. after the federal health care bill passed. And myself and about 5, 6 other people said, you know what, something like that could happen in Ohio. And so we set out to do just a couple things. One was make sure that we didn't have a compulsory-based system that was set up in Ohio, so something like the Massachusetts or Vermont-based systems. We thought that was inappropriate, that you could be compelled to purchase things in that way, and so we wanted to make sure that couldn't come to Ohio. And second part is we wanted to give ourselves the best possible standing, the best legal case that we could have in order to fight the actual individual mandate at the federal level. So we proposed this Healthcare Freedom Amendment, and then we went around the state for just over a year. That was in, March of 2010. We actually submitted this to the Ohio Attorney General and then began gathering signatures by May of 2010. There was a short Ohio Supreme Court challenge that we had to get through in order to begin signature gathering. But by May of 2010, we began gathering signatures, and when it was all said and done, our volunteers, which were the bulk of the effort, had gathered almost 450,000 signatures, which was one of the largest all-volunteer signature gathering efforts in Ohio history, and we're really proud of that. People came from all different political backgrounds, like myself, a lot of independents, definitely. But we were really proud that Ohioans stepped up and did something they firmly believed in to accomplish those 2 goals. Again, just to restate them, the things we wanted to do was make sure that we had health care freedom in Ohio so that we couldn't have a compulsory-based health care system come here, similar to Massachusetts or Vermont, and then also just give ourselves the best possible standing to challenge the federal mandate that came down from the health care bill. And those are the 2 things that we're trying to accomplish with this amendment, and I thank you for having me here today.
Thank you, Mr. Littleton. We'll now hear from Mr. Butland.
Thank you. Mr. Littleton's campaign wants you to believe that Issue 3 is about repealing what they call Obamacare. In fact, it is not. The fate of the Affordable Care Act will be decided by the U.S. Supreme Court, not by ballot initiatives in Ohio or any other state. The reason is in Article 6 of the U.S. Constitution. It's called the Supremacy Clause, and it says that federal law takes precedence over state law. Even though he's not an attorney, Mr. Littleton should know this, and more responsible Republicans do, like Ohio Attorney General Mike DeWine, for example, who has flatly contradicted Mr. Littleton's campaign on this subject. So if Issue 3 isn't about Obamacare, what is it about? It's about extremists like Mr. Littleton and his organization who want to insert a Trojan horse into the Ohio Constitution. A Trojan horse that would jeopardize literally dozens of already existing Ohio laws and regulations that we all rely on to keep us safe and healthy. How? Well, for starters, it says that no Ohioan can be required to take part in a, quote, health care system. But if no one can be required to participate in a health care system, how could courts force deadbeat parents to buy insurance for their kids? How could Ohio colleges require students to have health insurance as a condition of enrollment? And why couldn't any of us simply refuse to pay taxes for the hospital or MRDD levies that are passed? And that's not all. Under Section 21E, healthcare system is defined to include, and I quote, the management or processing of healthcare data or information. But without information, how could Ohio track the spread of infectious diseases, or monitor child immunizations, or crack down on those pill mills that we've all heard so much about? And it gets worse. The other 2 sections of Issue 3, as Mr. Littleton just mentioned, say that Ohio could no longer, and again I quote, prohibit the sale of health care or health insurance or impose a penalty for selling them. Think about that. If we can't stop the sale of anything someone might call health care, how would we stop unlicensed doctors from peddling quack remedies? If we can't prevent the sale of certain kinds of insurance, how do we stop con men from preying on senior citizens and selling them policies that are deficient, inadequate, or substandard? Now, Mr. Littleton will say that these are just scare tactics. None of them are actually going to happen. But the truth is, neither he nor anyone else can tell you how a court might rule on any of them. What we do know is that Issue 3 is careless and sloppily written, and it's going to breed an orgy of lawsuits. And we taxpayers would be on the hook to pay for them. That's why every major newspaper in this state has urged a no vote on issue 2. Forgive me, issue 3. And I do too. Thank you very much.
Thank you both for those introductory comments. I'd like to begin with a question for Mr. Littleton, and then Mr. Butland might want to respond to that. And that is, if you could elaborate a little bit more on how it is that you think this amendment to the Constitution will affect the law as it's been adopted by Congress and signed by the President.
Sure. One thing I'd like to address from the opening comment that he made is I completely agree with him. We've never even claimed that this amendment will directly overturn federal law. We don't presume. I'm a firm believer in the Supremacy Clause and have no argument with it whatsoever. So I'm not exactly sure where that presumption comes from. To answer the question at hand, this is the easiest way to say this. I guess I've explained it a couple times. It's to imagine yourself walking into a courtroom with your attorney. You know that the judge is going to make a decision on the fate of whatever it is that you're walking in. Whether it's a criminal case or anything else, the judge is going to make that decision. Imagine that the judge in this case is the U.S. Supreme Court. We are simply providing evidence based on protection of personal rights. Some of the things are outlined in the 4th and 15th Amendment of the U.S. Constitution, which talk about rights of citizens, that we cannot, through due process only, lose life, liberty, or property. So we're saying, hey, you're fundamentally imposing, you're fundamentally restricting our liberty and property here, and there was no due process. So we hope to walk in with the best possible case to have the U.S. Supreme Court, as that judge, hear that case and provide them with the best possible evidence.
Mr. Butland, any comments?
Yes. First of all, Mr. Littleton says that his organization has never claimed that this is going to somehow undo the Affordable Care Act. I've got right here. In fact, you can look at it yourself. This is from the Ohioans for Healthcare Freedom website, and it says things like this. These are frequently asked questions. Question: aren't states prohibited from contradicting federal law because federal law is supreme? Answer: this is not necessarily true, and courts can go either way on this question. I hope at some point today Mr. Littleton will be able to give us one single example of any court in America that has said that once the Supreme Court rules on the constitutionality of something, that states are not bound by it.
Following up on that, though, in the absence of a Supreme Court decision at this point, is it the position of the opponents of Issue 3 that the voters of the individual states should not be asked or given the opportunity to take a position on this?
All we're saying is simply this. This is a merely symbolic vote at best. It's allowing people to make a personal statement about what they think about the ACA, the Affordable Care Act. However, it amends the Ohio Constitution in ways that are going to be horribly damaging to these already existing laws and regulations that we just talked about. And I would submit to you that the reason we have a Constitution in this state is not to allow Mr. Littleton and his friends to make personal statements. We have a Constitution to guide our actions. And this amendment, if it is made part of our Constitution, will have untoward consequences for years to come and will be enormously costly because of the tsunami of lawsuits that will come as a result.
Also following up, and this is for both of the debaters here, do you expect the outcome of this vote will influence the Supreme Court's action on this in any way, and if so, in what manner? That is, mechanically, how would it work that a referendum in a state would influence the deliberations of the Supreme Court? And Mr. Butland, why don't you take that one first, and then we'll go to Mr. Littleton.
The Supreme Court is certainly always aware of the political milieu in which it's operating. But I think the Cleveland Plain Dealer, in its editorial, urging a no vote on Issue 3 said it best. It said that Mr. Littleton and his friends argue that, well, if we vote against it here, that is going to influence the Supreme Court. As the plain dealer said, that seems to be quite a stretch.
Mr. Littleton?
Sure. Just coming back to exactly what I said before, if you can't walk into court with evidence, why are you walking into court in the first place? This is going to give us incredibly unique standing because as citizens, it was citizen-initiated, voted on by citizens. We'll be amending Ohio's Bill of Rights, which is the only state in the country, assuming that this is successful, to have amended its actual Bill of Rights via citizen initiative. We now have completely unique standing in the U.S. Supreme Court to have this argument heard on the basis of rights. So it's incredibly important that something like this passes, so that we do have the most legitimate case in the United States. It will go to the top of the list as the most unique case to be heard by the U.S. Supreme Court.
May I just comment briefly on that?
Yes, please. That's fine.
Mr. Littleton, when the Supreme Court takes on a case, they rule on the constitutionality or the unconstitutionality of the law. They are not ruling on whether it is popular or not. That is not the purview of the Supreme Court. They decide is the law constitutional or not. And I don't have to remind you, I'm sure, Mr. Littleton, that if it were merely a popularity contest, when the Supreme Court ruled in Brown versus Board of Education in 1954 and ruled that segregated schools were unconstitutional, it was not a popularity contest because that was an unpopular ruling.
Well, following up on the reasoning there, again, Mr. Littleton and Mr. Butland, just to follow up on your statements, if this were to go the other way and Issue 3 were defeated, then would the failure of Issue 3 to pass equally be admissible evidence before the Supreme Court of the feelings of the people of Ohio, or more broadly?
Well, you're embracing the logic that the feelings of the people of Ohio is what the court is going to take into consideration. That's not at all what we're saying.
I'm not embracing anything.
Well,
I'm trying to better understand what you
correct,
were...
but that's the logic that he's using of a popularity contest influencing the U.S. Supreme Court. I actually would hope that the popularity contest wouldn't have anything to do with how impartial judges rule in any hearing. I would hope that our U.S. Supreme Court is better than that. That's completely different than what we're saying. I'm saying we're going to present them with the best possible case based on a rights-based defense. So if I'm looking at have my ability to, has due process been circumvented in this case, that life and liberty have actually been prohibited? Yes, absolutely. I'm happy to have that argument heard before the Supreme Court. And it has absolutely nothing to do with the Supremacy Clause. No one's challenging it. We definitely want to have arguments heard on both the Commerce and Necessary and Proper Clauses, because we think that this being added to our Bill of Rights and making sure that we do have a good citizen standing and a good statement of rights in the state of Ohio actually makes that law both less necessary and proper. And therefore, we're very confident that it'll contribute to the U.S. Supreme Court case.
To go off in a little bit different direction, we might come back to that a little bit in a few moments. I'd like to ask Mr. Butland about the comments of the opponents in the official pro and con work that is published in the newspapers. In this, State Representative Armand Budish and Mike Foley and Senator Capri Cafaro, who are the authors on this, indicate that voting no will stop insurance companies from excluding people, including children with pre-existing medical conditions, from getting health insurance. And then it goes on to address a number of other things that are underneath in the Accountable or Affordable Care Act, but are not specifically included in the discussion of the amendment. And I was wondering if you could clarify for us a little bit about the positioning of the opponents on those issues.
Well, I can't speak for Mr. Budish. Innovation Ohio, the organization for which I work, has joined in a coalition of a number of organizations. I think we have 38 or 9 organizations at this point that have signed on. And we have put out, and as a matter of fact, we have some literature out at the table that will give you all of our reasons why. I would say that I would take issue a little bit with something that was said in the newspaper there by, I don't know if it was Mr. Budish or who it was, but it says that voting no on this will stop insurance companies, for example, from excluding children with pre-existing conditions. The truth is that's already stopped because the first phase of the Affordable Care Act, called the Patient's Bill of Rights, is already in effect right now. And as a result of that, insurance companies are prevented from denying coverage to children. You can keep your child on your policy until he or she is 26 years old and so forth. But my concern is that what Mr. Littleton and his friends seem to want to do is go back to the days when the insurance companies are in charge. And I don't think that's where most Ohioans want to be.
Mr. Littleton, any comments?
To address the substance, what we're doing has absolutely nothing to do with the remainder of the federal health care bill. We don't seek to affect it. We're not trying to say anything about it. There's solutions and there's conversation, and I think there's legitimate things that need to be said about health care reform, because I'd agree with, and I bet every person in the room, I think we'd all share in this concern, that the health care system as we know it is completely broken. We have significant problems with cost increases, but this doesn't have anything to do with that conversation. So
well, let's get into a couple specifics then with regard to what is in health care reform and what would be affected by the amendment and what wouldn't be. For example, the mandate that individuals and families buy insurance obviously is intended to be affected by this. What about the insurance exchanges that the legislation requires the states to establish, but which are optional with regard to people's participation in them? Does this amendment affect the exchanges in any way?
Yes, it will definitely affect the exchange if the state took it upon itself to create that exchange. And the one single part that it would take, we couldn't certainly say the state is not allowed to do that, and we certainly don't presume that the federal government isn't allowed to do that. The only thing that we're asking, and the only thing that this addresses, is compulsory participation in one of those things. We do not think, once again, I could come back to it 100 times today, we do not think that compulsion is necessary to accomplish a great many of the good health care reforms that have been proposed and debated, and there's plenty of wonderful things. But why is compulsion required in order to do those things? Why do you have to tell someone we're going to fine you in order to do that? Why is threat of jail time something that has to be considered in this calculation for the common goal that we all have of fixing the health care system? It's the only thing this addresses. It deals with compulsory behavior.
Mr. Butland, any comments?
Well, with all due respect to the chair, I would be happy to engage Mr. Littleton or anyone else in a debate on the ACA at some point, but my understanding is that's not what we're here today to talk about. What we're here to talk about today is Issue 3. And Issue 3, as I've just indicated, and I think we've all established and agreed to, will have absolutely no impact on the constitutional fate of the Affordable Care Act. What it will do is have an enormous impact on all sorts of other rules and regulations. Let me give you an example. And by the way, this is not just something that liberals ought to be concerned about. Conservatives ought to be very concerned about that, too. Innovation Ohio, the organization for which I work, just put out a news release today. You know, the anti-abortion legislation that was just passed in this last legislature, that has reporting requirements in it, apart from the fact that it also runs afoul of Issue 3's prohibition against not allowing people to sell health care. That is a health care procedure. That would run afoul of it. So would the reporting requirements. Workers' compensation. The governor wants to reform workers' comp. You can't do that under this. It's frozen in place as of March 2010 under their sloppy wording. What I'm telling you is the implications for this are absolutely pernicious, and that is why we cannot add this to our Constitution. Every newspaper in Ohio agrees with that.
Looking at the position, the official position of the proponents of the amendment, again, in what has been published in the newspapers and certified by the Secretary of State and so forth, it's stated the freedom, I need to pull this a little bit closer, excuse me. The freedom to not be forced to purchase government-defined health insurance is a fundamental right implicit in the concept of ordered liberty and deeply rooted in our history and tradition. Basically, that is what a yes vote means, according to this. What is the reasoning behind that freedom from being required to purchase health care as a fundamental right, as opposed to, say, a more general right to not be compelled to purchase commercial products in general, say?
Sure. This really addresses the idea of negative and positive law and negative and positive liberty. The intent of a Constitution, certainly the U.S. Constitution and the Ohio Constitution, is stated in both of their respective preambles, is to protect liberty, is to protect choice, is to protect private property. Contract law is a general idea. But it certainly did not ever intend, theoretically or otherwise, for a state to have the power to make you purchase a commercial product. Now imagine this, if you will. You are completely minding your own business. You're just living life. You're at your own home. You're watching television. If a government has the ability for you just minding your own business to compel you to actually purchase a commercial product, it literally defines completely unlimited power within that government. Now imagine that you are now compelled to purchase something that you don't like, or maybe something that you even do like but couldn't possibly afford. And I'm going to give you a silly example. It's completely intentional that I'm using a silly example because it reflects the absurdity of the idea that the government can compel you to purchase something without participating in any form of commerce. What if the electronics industry is suffering and they go, you know what, we're going to mandate that everybody purchase flat-screen televisions? They have the ability to do this. And this law, in this instance, when you start compelling people to purchase things without any participation in commerce whatsoever, you have now given unprecedented power to the government, and that's something we definitely do not want to see happen.
Mr. Butland?
Although I would like to reserve my right to not engage on the ACA, I will to this degree. What you just heard from Mr. Littleton is utterly preposterous. Jeffrey Sutton, who is one of the most conservative judges in America, he's on the appellate court, also teaches at Ohio State, actually cast the deciding vote upholding the constitutionality of the ACA not long ago. And the reason is, unlike healthcare is not a commodity like electronics or a computer that you can choose to buy or choose not to buy. Sooner or later, everyone is going to need medical care. The only question is, who pays for it? Sooner or later, when you get sick, or when you have a terrible disease, or you wrap your car around a tree, unless you're a wealthy person and can pay for it yourself, someone else is going to be paying for your care. And that's really what's behind this.
I'll offer just 2 seconds to that. I actually agree with President Obama's 2008 presidential position on this. And that was, if we could fix, and this is, I'm not going to quote him exactly, I'm sure I'll miss a word here, but he pretty much says in a television ad, if we could fix homelessness by mandating everyone to buy houses, fix the problem, wouldn't it? This doesn't fix the problem. This doesn't address the problem. Mandating people to purchase things does not actually address the fundamental problem. So I agree with him on that point.
But again, and I'm asking this just for sake of clarity, again, to understand, the proponents of this are opposed to the principle of the government requiring people to purchase a commercial product. Why limit the amendment to health care?
Compulsory, it starts, we'll address the ACA just for a moment. So the justification for this is coming from the Commerce Clause. And the idea is that if you are somehow participating in commerce, that we can compel you to control your lives, we can compel you to do anything. That's the concept here. But the difference is that I'm not participating in commerce by simply staying at my house, by simply minding my own business, and by not doing anything. And there's a really interesting judge, lower level. It wasn't a federal. It wasn't one of the circuit cases that's been heard, and it wasn't the 11th, most recent that was won with my side. They talked about the idea of mental activity being part of commerce. I mean, this is a scary thing to me, and I think a scary thing to a lot of people who really fundamentally believe in the protection of personal and economic liberties, that mental activity is not something that directly affects commerce.
May I comment?
Yes.
So this goes back to what I said in my opening remarks. Mr. Littleton continues to maintain that no one should be forced to participate in a health care system. I would ask Mr. Littleton again, if no one can be compelled under your amendment to the Ohio Constitution, if no one can be compelled to participate in the health care system, how can a court order a parent to buy health insurance for his or her child? How can Ohio colleges require students to have health insurance as a condition of enrollment?
Do you want me to answer it?
Yeah, that'd be fine.
Sure.
Yes.
There's a great number of things that Dale takes for granted, and one of them is that it says explicitly in this amendment that it's not going to change or affect laws or rules. In fact, it's one of the very first parts, prior to March 19th of 2010. So by passing this amendment, it doesn't automatically erase everything from the past. So for instance, this isn't going to magically erase the ability to tax people. And there's a whole bunch of things that will probably come up. Healthcare levies, a whole great number of things would be affected by taxation. We simply can't, by passing a new amendment, and especially when explicitly stating it, eradicate all of the laws in the past. So it's sort of a fundamentally flawed starting point.
So let's just take that if we can. Mr. Littleton says, oh, don't worry, because we have a grandfather clause in there. Any law that's on the books prior to March 19th of 2010 is protected. Think about that for a minute. The statute that allows or authorizes courts to make child support orders where parents have to buy health insurance for the child authorizes, but the court in each subsequent order is a new order. So any child support order requiring a parent to buy health insurance for the child after March 19th of 2010 is challengeable in the courts. Workers' compensation, another great example. Under his amendment, what the current rules on workers' compensation are frozen in place forever. You can never change them, because if you change them, now all of a sudden it's now subject to this new amendment, and it's unconstitutional.
Just a couple quick questions here then to wrap up this part of it. I have a couple more I'd just like to toss out there. One, since the question of issue 2 came up earlier, there's been a talk back and forth about the connections of the pro and con positions on issue 3 being connected in one way or another to those on issue 2. For the sake of the listening audience, Mr. Butland, we'll start with you. Is there any connection between the two campaigns?
I'm sorry, I didn't catch
the campaigns on issues 2 and 3. Any connection between them?
Well, certainly. Well, I think I can speak to the other sides. I can tell you that on our side, no, there is no connection at all. There is very much a connection, however, on the pro-issue 3 side. To wit, when they were having difficulty gathering the required number of signatures on those petitions to get it on the ballot, the Republican Party at the 11th hour came in with manpower and with a little bit of money to help them get over the top. In part, that was because the Republican Party thought, well, this is a good way to drive conservative voters to the polls, and while they're there, they might also vote against issue 2. Now, Mr. Littleton, I think earlier on, indicated that he is not a partisan person. You know, Mr. Littleton, I actually been reading some of your stuff. I went to the Cincinnati Tea Party website, and this is what you wrote, and I'm just going to quote a very short piece of it, what you wrote just over a year ago. We need to defeat all Democrats this November, even those we may like. Let me illustrate with an example. If Ronald Reagan were alive today and were running for Congress as a Democrat, I would vote for his Republican opponent. We have to become the soul of the Republican Party. Now, if that is your idea of neutrality, Mr. Littleton, what in the world is your definition of partisanship?
Could I question your idea of truth? Who wrote that article?
You did.
False. Jack Painter did.
It says a speech on the Tea Party movement by Chris Littleton, sir. I've got it in my hand.
It's by Jack Painter. I will assure you I'll happy to deliver that to you in its original form. Not a problem at all. I posted it because it's a Cincinnati Tea Party blog, and most things post under my name in there.
Mr. Littleton, all I can tell you is that it's on the Cincinnati Tea Party blog. It says a speech on the Tea Party movement by Chris Littleton.
Yeah, by Chris Littleton, in that I had to pen the blog. I took Jack's speech and put it into the Cincinnati Tea Party blog. So good job on truth finding there, bud.
Thank you both. We'll now have the traditional City Club question and answer period. Questions are to be addressed to a specific proponent or opponent here. They will have 2 minutes to respond to your questions, and the other person will have 1 minute to offer a rebuttal. And we have our first question back here.
My name is Dr. Jerry Liebman. I'm a pediatrician. There is no question that one of the things that has saved lives over and over again in this country is immunizations. And I understand that if you say no on this issue, that immunizations will no longer be required. And I know there are right-wing groups, for example, that say immunizations cause autism, etc. There's no data that that's the case. So do you really believe that there should be no immunizations for children?
Well, of course not, nor does this overturn the ability to immunize in the state of Ohio.
But with this bill, there would be no requirement for immunizations.
No, that's not true. I mean, for instance, if you're going to school, this is, I guess, part of the flawed logic that Dale continues to use is that somehow this is going to overturn things in the past. It doesn't overturn things in the past. And with regards to the future, most things that school attendance and a whole bunch of other things, if I can choose to not immunize my child right now as we speak. I'm not required to compulsory participate in any particular school. We're only talking about behaviors relating to compulsion, and that doesn't change.
That's exactly right, Doctor. Under this amendment to the Ohio Constitution, child immunizations, compulsory child immunizations would no longer be required. And let me just say one other thing. Let me show you how extreme these folks are. And I've used that word several times, and I don't want anyone to think I'm being uncharitable. Maurice Thompson is the author of Issue 3. He is affiliated with something called the 1851 Constitutional Society or Law Society or something or other. In the Columbus Dispatch, Mr. Thompson was quoted as saying that one of the things that Issue 3 will bar is women, Ohio girls, being vaccinated against the HPV virus, which, as we all know, causes cervical cancer, and now, just this week, they're saying heart disease. And that is what these folks are up to. That's how extreme they are.
Do we have another question from the audience? Well, while you're all busy thinking of one, I'll throw another one your way. I want to go back to the fundamental thing here because it's confusing for me. I came here thinking I knew something about this, and now I'm confused. Here's wording directly from the amendment that's proposed, and this is proposed Article 1, preservation of the freedom to choose health care and health care coverage. And then Section 21A, this would be going into the Constitution, no federal, state, or local law or rule shall compel, directly or indirectly, any person, employer, or health care provider to participate in a health care system. Now, inasmuch as federal law does have compulsory provisions, and one has to assume that this is aimed at the Affordable Care Act, how is it that that doesn't amount to something approaching nullification or something along those lines? This is proposed to go into the Constitution. And Mr. Littleton, I think perhaps you should go first, and then Mr. Butland.
Sure. Once again, it's outlined in the amendment. This is simply not something that talks about nullification. We have never claimed that it was nullification. That's something that Dale loves to talk about that we've said, but it's just simply not something we're trying to do. Once again, the two things that we will hope to accomplish and have always hoped to accomplish with this amendment. One, we do not want a compulsory-based system like Massachusetts or elsewise coming to the state of Ohio, and we hope to give ourselves the greatest legal ground and standing to challenge the constitutionality of the individual mandate at the federal level. But we have never claimed that this just nullifies a law. It's simply not true.
But what they are attempting to do is to set up in the Ohio Constitution something that may very well be in direct conflict with a federal law that may very well be found constitutional. It is, therefore, as we've already established, let me say this one more time, under any conceivable set of legal circumstances, Mr. Littleton's amendment is either going to be unnecessary or it's going to be irrelevant. If the Supreme Court rules that so-called Obamacare is unconstitutional, then his amendment is unnecessary. If they rule it is constitutional, then his amendment is irrelevant because federal law trumps state law. So it is a meaningless exercise insofar as the ACA is concerned, but it will have tremendously negative impacts on Ohio so far as our own Constitution is concerned.
Yeah, I mean, once again, ask yourself a very simple question. If you ever walk into a courtroom, would you want to have evidence that you could present to the judge? And all we're doing. We're presenting evidence to the U.S. Supreme Court.
The evidence that you're suggesting is whether the law is popular or not.
No, it's not.
Well,
Dale,
that's what the vote is about, is it not?
Dale, you're flat out lying, bud. I mean, I don't know what else to tell you.
Well, I'm way out of line.
So I say that I would like to have this challenged based on the case, the rights-based case. and you simply come back to the argument after I said, I hope that the U.S. Supreme Court does not take popularity into account. You then bring it up explicitly saying, oh, don't worry about any of that.
You're
simply jumping back.
You have got campaign you just aren't telling the truth today, Chris. I've got campaign literature here in my bag. I'd be glad to show you that your campaign is putting out, saying to people, it's your choice to decide whether or not the Affordable Care Act stands or falls. It's your choice. Now, is it really their choice, Mr. Littleton, or is it the U.S. Supreme Court's choice?
This will absolutely contribute to the evidence that's presented to the U.S. Supreme Court. To deny that is simply to deny reality.
Who would be presenting the evidence? Could you give us an example of how the mechanics of how that might work?
Well, that's certainly something we don't know yet. We could take this case on our own. In this case, probably Maurice Thompson, one of the attorneys that's been involved all along. We put together a legal team, and we would have this as a standalone case that moves to the U.S. Supreme Court, and there would be a new challenge. There's a possibility, I've heard, just reading legal experts around the country, that they could take, because there are multiple cases that are sort of pending at different federal levels. And most recently, the one that would fall in our favor of ruling the individual mandate unconstitutional out of the 11th Circuit is pushing it up the ladder very quickly. There's a possibility the U.S. Supreme Court could say, you know what, we're going to lump these together. We want to hear multiple at once. We'll take your position. We'll take yours. I don't know the answer to that. Actually, no one really knows the answer to that. It's just sort of presumptions at this point. But we're prepared, if necessary, to take this as a citizens-based, rights-based case on our own and would hear it on behalf of Ohio citizens.
That would be if the amendment were adopted, I assume.
Yes, of course. It's all based on the passage.
You have a question back there?
Hi. I've heard you mention, Mr. Littleton, that people are not required to buy certain things, but I am required to get auto insurance.
Sure.
And so help me discern why that's okay in comparison to having to buy health insurance, because they both can be costly if one is not insured.
One of the conditions for that compulsion is actually car ownership. Nobody forces you to buy a car or drive on the roads. In this case, I'm at home minding my own business. Once again, just simply because I don't want to do it, I'm still going to be forced to, regardless of my participation in anything.
And that is precise. If I may follow up on that, that's exactly the point. That's why health insurance is different from automobile insurance or, frankly, any other public product. As Mr. Littleton said, you can choose, I suppose, not to drive a car and to take public transportation. And if you do that, then you don't have to buy auto insurance. But you don't have a choice of whether or not you will need medical care. Sooner or later, everyone without exception will need medical care. And when that happens, the question is, who pays for your care? That's why it costs $10 for an aspirin now. It's called cost shifting. When people who don't have insurance wrap their car around a tree or come down with a horrible disease, they go in, they get treated. Who pays for it? You and I do, everybody else who has insurance.
Now, let's talk about how that compulsory-based model has worked out in every other place it's been tried. Massachusetts, the model for this, is the highest health care premiums in the United States now. So if you are advocating for a compulsory-based health care system on the idea that you want to lower cost and shift like he's talking about, absolutely. You will get cost increases in the state of Ohio of the likes you've never seen in your entire life if we used a Massachusetts-based compulsory system.
The truth is that every other country in the industrialized world has some form of universal health insurance. Every other country, and their premiums are 2, 3, 4 times lower than ours, as are their medical costs. What is driving the cost is the increasing cost of medical care. We have to figure out a way to bring that down under control.
Correct.
But it is ludicrous to suggest that we can do that without including everybody into the pool.
Sure, two things.
And let me just finish.
So easy.
We have had a system here, Mr. Littleton, where we've never included everybody in the pool. And I ask you, how well has that worked out?
Right.
We've had health care costs escalating at 4 and 5 times the rate of inflation now for years.
Yep. Okay. Let's
I'll
move back. We have
yield to
another
him.
question back here, and we'll have a chance to
I'll
come
yield to
back,
him.
both of you. Yes.
Hi. I wonder if there aren't people who will see this for the first time when they get their ballots and see healthcare freedom and think, oh, yeah, that's something I should support because it sounds like American and apple pie. And the fact that the great majority of voters, people who actually vote, happen to have health insurance, which is another discussion.
I saw it.
But
Yeah.
to what extent would this really actually impact most voters who have health insurance if they think in some way, I think some people might vote for it thinking that in some way it's going to change something about how they're insured. And will there be any impact like that? That's my question.
I think the sense of your question is
Hold
a
it,
very
let's,
good one.
if I could, let's
Oh, I'm
just
sorry.
a little
I'm sorry.
go
Finish,
first on this
Alston.
one, and then we'll come back. Thank you.
Yeah, I hope that you hope this for every voter, and I think in every election, that they'd really review every issue. I hope people read every single word of this and take it to heart. I'm an individual that is self-insured, so I don't have my insurance through an employer or anybody else. And this is certainly a deeply personal issue to me, as I think it will be to most people. I look at what happened around the country in other states, and this is actually not a compulsory-based system necessarily, but changes, very, very significant changes similar to what happened in Massachusetts. It's happened probably, I think it's 8 states now. And one of the things is self-insure that we saw happen in a lot of those other states is, I'll use New York as an example, that about 4.5% of their population was self-insured like I am. And when the changes started kicking in, we started messing with what the government could change about the defined plans. That number is now down to about 0.5% of people. And in a lot of states, they're completely eradicating the plans altogether because the conditions for participation were changed so rapidly. So for me to advocate for that, boy, I hope that people read through these things. I hope they really consider what's being done here when I'm losing healthcare freedom, healthcare choice in these scenarios.
Thank you, Mr. Littleton. Mr. Butland?
You know, there's an old adage there, Chris, you should be careful what you wish for, because if people really look at this and really understand what it's going to do, they're going to reach the same position as every major newspaper in Ohio. When we first started this, Innovation Ohio actually recruited a couple of law professors from Case Western here, 2 very distinguished law professors, Max Mellman and Jesse Hill. We had them look at the language of this amendment with us, and they're the ones, along with our staff, who concluded the incredibly negative effects this would have on the Ohio Constitution. So we started sending this off to newspapers around the state and asking them to actually look at the language, to read the language of this and figure it out. Most newspapers had not even looked at it. They figured, that's just about Obamacare. It's not going to matter one way or the other because the court will decide that. But once you get into it and you realize the implications for the Ohio Constitution and Ohio laws, that's why, as I said before, every single major daily newspaper in Ohio, from the very conservative Columbus Dispatch to the Akron Beacon Journal, Blade, the Plain Dealer here, all of them have said the same thing. This is bad medicine. This should be voted down.
It's interesting that you argue against the popularity of it, which I say has no stake, but then you support that as your primary reason to not support it.
Popularity? What are you talking about?
The popularity of editorial boards.
The popularity of editorial boards? No, I don't
your-
think you understand how editorial boards work,
That's
Mr.
your
Littleton.
primary contention?
We have another question here.
Hi, my name is Wendy Pitts, and I'm from VCAP UAW 1005, where my union bargains for my health care, because we live in that kind of state. I have a daughter who's in college who I got away with $2,000 worth of more payment for college because I have health insurance, and I can pay through that bill that we have right now. Before I got this job that bargained for my health care, I had to go to a court system to get my ex-husband to pay for her health care. So you tell me, explain to me how that's going to help someone who doesn't have a job that bargains for their health care, make sure that the children have the health care that they need in Ohio.
I'd like to begin this one with Mr. Butland and then go to Mr. Littleton.
The answer is it won't. This will not help the children of Ohio. It will not help children of divorce, as I indicated in my opening remarks. You would not be able to, any order that a judge makes subsequent to March 19th of 2010 would be subject to legal challenge. And that's the point with regard to all of these things. This tsunami of litigation that would occur as a result of this, it's going to be wonderful for lawyers because this is going to be the Lawyers Full Employment Act of 2011. But for the rest of us who are going to be on the hook to pay for these costs, it's going to be horrible. And again, why in the world would we take on these costs and run these risks, these horrible risks, just so we can make a symbolic gesture or cast a symbolic vote on Obamacare? That's preposterous.
Mr. Littleton?
Once again, you might want to figure out what you're trying to say. It's either a symbolic vote or it means something and it's going to change things. You don't want to pick an argument. Apart from the comments that you just made, one of the things is just let's look at what's happened in other states. I mean, again, I don't have to talk about these things in theoreticals. The states where they have something similar to this, that they passed an amendment similar to this, so Arizona has something similar, Oklahoma has something similar, there's multiple states. We haven't seen these things happen. These magical scenarios that Dale's trying to paint over and over again and then contradict his own words with, I guess I feel a little sorry for him because I can just point to what's really occurring in other states and the real test models and the real test model for Massachusetts. And I know exactly how it plays out because I'm watching the other states and how they're going through it right now.
Mr. Butland.
Let me make two comments. First, let me try to say this, Chris, slowly. The impact of Issue 3 on Obamacare would be symbolic, but it has very real consequences for the state of Ohio. As for Arizona, and I'm glad you brought that up because I actually looked at the Arizona amendment. Have you, Chris? Sure. Well, then maybe you noticed that it does not stop the state from prohibiting the purchase or sale of health care, like your bill does, which means that Arizona, unlike Ohio, if this thing passes, Arizona can still regulate health insurance, the practice of medicine, and other related professions. But they couldn't do that in Ohio. Secondly, this thing in Arizona passed November 29th of 2010, so there simply hasn't been enough time now for all the individual in the interest involved there to file the lawsuits to invalidate the new state laws, as we say is going to happen in Ohio.
Point made. Back here, we have another question.
Yes, I would like to ask Mr. Littleton, suppose I do end up in an emergency room, unconscious, and I am stabilized by this emergency room because it's under Medicare and managed oversight. And I am stabilized out of implied consent as a result of the 1986 law, the Emergency Medical Treatment and Active Labor Act. 1986, but as explained today, if this issue passes, would lawsuits and orders resulting from it invalidate this Emergency Medical Treatment and Active Labor Act?
No, it's right in the amendment. Again, Dale's not arguing that either, that it doesn't affect laws or rules in effect. It's right in there. It does not affect laws or rules in effect as of March 19th, 2010. So no.
Lawsuits and orders resulting
but that's not compulsory participation in a system. Is a different. Right, but not in this instance. You don't have to. I mean, there's a million scenarios here. Schools, hospitals. There's a whole bunch of things. So, for instance, I mean, so much of this is. I wish we could have passed out a copy of this. It would make it so easy. Proposed law would not affect which services a healthcare provider or hospital is required to perform or provide. It's addressed right in there. And it also does not affect any laws calculated to deter fraud or punish wrongdoing in the healthcare industry. So. It's outlined, I mean, in black and white. I guess it couldn't be more simple in a way.
But as the March
Yeah, it doesn't matter.
We can't, I'm sorry.
Even moving forward, those things apply. Those are separate amendments.
Let me just say,
it's addressed in the amendment.
What Mr. Littleton just said is another example of the sloppy, careless, and ambiguous wording in this amendment. It's true that the amendment has the word wrongdoing in it. What the hell does that mean? It's not a legal term of art, nor is wrongdoing defined anywhere in the amendment. So it's whatever courts decide that might be. This is the problem with this amendment. It is sloppy, it is ambiguous, and it is going to lead to an incredible tsunami of lawsuits.
We want to thank the audience for your questions and the respondents for their comments. We're now at the part of the program where there's time for a closing question. Each debater will be able to ask a question of the other side. The other side will have 1 minute for response. As determined before the program, Mr. Butland will go first.
So we've talked a lot this afternoon, Mr. Littleton, about the Supreme Court's ruling on the constitutionality of the ACA. And yet, in a newspaper article posted on your organization's website, the author of Issue 3, Maurice Thompson, says the following, and I quote him directly. Even if the Supreme Court says the Commerce Clause allows the legislature to pass the ACA, do individuals nevertheless have the right to be free from it? My question to you, Mr. Littleton, is this. If individuals have a right to be free from this Supreme Court ruling, then by your own logic, wouldn't individuals also have a right to be free from other laws and Supreme Court rulings, like the ones outlawing segregated schools or denying restaurant owners the right not to serve African Americans?
Well, I think the best answer to that is let Maurice answer for himself. He's not here, so I can't say what he...
He's the author of the amendment.
Correct.
I thought you were representing the amendment here.
Sure, but I have absolutely, you know this obviously from being interviewed, we have no context for anything that was said, anything he led up to. I'll answer as best I can, and that is I know that we have always talked about this. If the Commerce Clause route, which is really the direction that the Attorneys Generals are going in, is somehow struck down, it doesn't negate what we're doing from a rights-based approach. There's actually two different paths to having the individual mandate ruled unconstitutional, and you're also presuming through logic and just repeating the words that somehow we're saying that this nullifies or overturns existing law. We haven't even said that. All we're saying is we want to provide the best body of evidence to the U.S. Supreme Court to have the individual mandate struck down. And it sounds like what Maurice was shooting for is there's one route through the Commerce Clause. There's going to be a fight that's had there, and I'm happy to see that fight successful. I hope the state's attorneys generals are. I'd be fine with that. But if not, we can go another route, so it's not dead at that point. The fight's not over. We'll go a rights-based approach, which we're happy to have. And this particular amendment gives Ohioans unique standing in the U.S. Supreme Court's mind to have that fight.
Okay, Mr. Littleton, you have an opportunity to ask Mr. Butland one final question.
Yeah, I suppose this is more of a philosophical question than anything, really. But why is compulsion necessary in order to accomplish the goals that I think everyone in the room, I stated before, really agrees on? And that is, everyone thinks the healthcare system's broken. Everyone thinks access to care is a problem, and everyone thinks that cost is rising. Why is compulsion the only way? I mean, the fundamental inhibition of liberty, just our freedom to choose anything, why does that have to be restricted in order to accomplish these goals? Because we all agree on the goals.
Mr. Butland, 1 minute, please.
Mr. Littleton, we have in our state, for example, in order to track infectious diseases, just to take that one example, in order to track infectious diseases, we have to mandate that people report, make reports. That's how we track that stuff. That's how the Centers for Disease Control in Atlanta. That requires reports. They are mandatory reports. Under your bill, under your amendment to this Constitution of ours, that would no longer be possible. That would be unconstitutional. Nobody is arguing for broad-based compulsion. What we are suggesting is that you have to pick and choose and use common sense. And sadly, in my view, common sense is lacking in your amendment.
Ladies and gentlemen, that concludes our debate. Let's give our respondents a round of applause. Today at the City Club of Cleveland, we've been listening to the City Club debate on State Issue 3, Dave Butland from Innovation Ohio and Chris Littleton from Ohioans for Healthcare Freedom. Thanks to IdeaStream for broadcast support, and thank you, audience. This forum is now adjourned.